Hi, my name is Kaitlyn McKinley, and I will be presenting my senior thesis titled Adolescent Suicide, the School's Role to Finding an End. I became interested in this topic since from middle school and high school and college, I've seen so many friends and classmates, coworkers who have either attempted suicide or been successful, and this sparked my interest in finding out what could be done in order to possibly prevent this from happening. Mental health disorders can have an effect on all too many people, whether they suffer themselves or they have someone in their life that does. It may take the form of major depression, anxiety, bipolar disorder, post-traumatic stress disorder, among many others. These mental disorders can be so all-consuming and can bring those suffering to such low points. Too often, these disorders can end in the worst-case scenario in which the individual decides to take their own life as an escape and a means to put an end to their suffering. According to the Centers for Disease Control and Prevention, suicide is the overall 10th leading cause of death in the United States, the third leading cause in those ages 10 to 14, and the second in those ages 15 to 34. These statistics of adolescent suicide are shocking, considering that it is a preventable form of death. In order to bring the adolescent suicide rates down, something has got to change. Since many adolescents are in school from around ages 5 to 18, reaching students in this environment is a logical start. This leads to an overarching focus question to address this complex problem. What can be done by the schools to work effectively toward preventing suicide in adolescents? Since there is no one single discipline that can answer this question, an interdisciplinary approach is necessary. The first discipline I used was health education. This discipline addresses personal or societal health issues and searches for a valid solution to these problems. The second discipline I used is human resources. Human resources is an interdiscipline, but the aspects of staff training and development and program implementation are specifically useful when addressing this complex problem. The discipline of health education allows school-based suicide prevention to be viewed in terms of education tools and teaching methods that are most effective and material that needs to be covered in a school program. Multiple screening and curriculum-based prevention programs have been addressed by researchers. They have examined their overall effectiveness on the attitudes and behaviors of the participants and their contribution to reducing the teen suicide rate. While there is no one educational method or program that has been proven to work for every person in every situation, researchers have made arguments to support each discussed method and have given further ideas for improvement of the program to be made more effective. In the article, A Systematic Review of School-Based Suicide Prevention Programs, researchers give an overview of different types of suicide prevention educational programs that have been put into place in a school setting. There are multiple types of prevention programs that are used in schools, including educational curriculum, suicide risk screening, gatekeeper training, peer leadership training, and skills training, all of which are described and studied for effectiveness by these researchers. Researchers concluded that while programs under the skills training and educational curriculum categories show to have an impact on adolescent suicide attempts, there cannot be said for there to be a best practice prevention program for all schools. Jerry Safone highlights two main concerns of a curriculum-based suicide prevention program: that these programs may cause people to be reluctant in seeking help by relating suicidal thought to mental illness, and that the program may be upsetting to students at the realization that suicidal thoughts and behaviors stem from mental illness and is not a normal reaction. He argues that the best method for prevention would be to present students with a curriculum-based presentation to inform them of suicide and mental illness, followed with a screening tool for those who still show signs of suicide. He studied a high school suicide prevention program that used this method and found that it can increase help-seeking behaviors and change attitudes towards suicide. King, Strunk, and Sorter evaluate the effectiveness of surviving the teen suicide prevention and depression awareness program created by Strunk, which uses Bandura's self-efficacy model and social cognitive theory to try to enhance students' perceived self-efficacy in identifying suicidal warning signs in peers and themselves, and in engaging in appropriate help-seeking behaviors once suicidal signs are detected. This suicide prevention program aims to increase students' overall knowledge about mental illness and suicide, eliminate the stigma, teach coping skills to students, and encourage help-seeking from peers, family, and school through creating connectedness. After completion of the study, the researchers recommend that school districts formally implement the use of educational suicide programs in schools that should be followed up by intervention and postvention plans in order to work towards lowering suicidal risks and behaviors. Another presents the Adolescent Depression Awareness Program that focuses on educating students on depression rather than suicide. The researchers argue that programs focusing on suicide prevention have been shown to actually increase the acceptability of suicide in some previous attempters. This program can be used in schools to teach adolescents the symptoms of depression so that they can use the knowledge to see them in themselves or their peers. It is also suggested that this program be followed by a screening. If screening is used to find those in need of treatment, then the knowledge gained from the program may also be helpful in undermining the stigma of mental illness, which in turn could lead to peers being more supportive of those in need of help. Literature in human resources is produced that exemplifies the use of training and specific training techniques to prepare administration, faculty, and staff to identify warning signs, at-risk teens, and how to properly approach and report them. Researchers explore and compare different training options existing among a variety of schools and areas. The goal of the human resources discipline, as it pertains to this issue, is to ensure that training methods are proactive in preparing faculty and administration to implement school-based suicide prevention programs and to calmly and effectively help students in need. In order for a school-based suicide prevention program to be successful in schools, program type, staff training, and program implementation must be thoroughly thought through by school personnel. Without special consideration to these areas, the likelihood of a program being helpful to students greatly declines. Researchers exemplify this through interviews with a wide range of school personnel from different schools in the Los Angeles Unified School District, which has implemented the Youth Suicide Prevention Program. The interviews conducted by researchers aim to find the differences in high implementation schools and low implementation schools. The study found that one important factor that was repeatedly discussed was the need for well-organized and clearly communicated suicide prevention processes and protocols. The study also found that not only did the school need to have resources available, but leadership to back the cause if the implementation of the program is to be successful. Researchers concluded that programs cannot be created to be strictly cut and dry for every school and every student, as each situation is different and faculty and staff should be prepared to deal with those differences. King and Smith explore Project SOAR, which is a program for school counselors to learn how to most appropriately coordinate suicide prevention efforts in their local building, as well as how to initiate intervention steps when a student threatens or attempts suicide. The training course focuses on listening, intervention, and knowledge of suicide and crisis theory. One finding was that those who received recent training were more prepared and confident in identifying and helping at-risk students. According to social cognitive theory, increased experience in performing a given task is associated with increased confidence that one can successfully perform the given task. The researchers use this to argue that school staff should receive periodic training to be better equipped with the knowledge and skill to handle these situations. Gibbons and Stutter expand on school staff training methods for the implementation of school suicide programs by outlining a training program. The researchers argue that the importance of teachers receiving such training is due to the fact that they are most often in contact with the students. It is also mentioned that staff training should take place more than once, reiterating King and Smith's point of training with the social cognitive theory in mind. These researchers suggest that the program should cover a review of verbal and behavioral warning signs of suicide, social policies and procedures, beliefs about suicide, and opportunities to practice identifying suicidal behavior. Once staff is aware of these topics, they should be better prepared to carry out a suicide awareness program in their schools and identify and refer at-risk students. One study focused on health teachers and their ideas on their role in identifying at-risk students and how well they believe they are capable of doing so. Researchers found that health teachers found it of great importance to be able to identify an at-risk student and felt as though that it was a major part of their role as a teacher. However, it was found that only 9% of high school health teachers in the present study believed that they could recognize an at-risk student for suicide. Researchers concluded that it is likely these teachers have not been made aware of what to look for, and a training program would be beneficial to teachers to solve this issue. Once again, it is argued that through social cognitive theory and learning through repeated teaching and experience, these high school teachers would be able to identify and refer at-risk students with greater ease. Other researchers consider adult learning theories in their training approach to using role-play strategies accompanied with gatekeeper training. These theories indicate that behavior change and thus skill development is more likely when active learning strategies are employed. Their argument is that using this type of learning strategy will better prepare gatekeepers to face the emotional task of confronting at-risk youth because of the practice in similar simulated situations. While the study found that these strategies did not necessarily improve the adult's ability to work with at-risk students, it did still provide some insight into the issue. It was concluded that teachers and school administrators are far too uneducated on the topic of suicide, and school-based training of teachers and administrators about how to identify and respond effectively to mental health issues that arise in the classroom should be a part of a comprehensive approach to mental health issues in the school setting. Conflict can be found between different authors from the health education discipline who have conflicting assumptions based on the theory that suicide is usually a consequence of mental illness. Swartz made an assumption that focusing only on mental illness as a disease rather than specifically mentioning suicide would lead to more students seeking help and less acting on suicidal thoughts. The need for schools to implement a depression education program rather than a suicide education program to teach students how to recognize, treat, and seek help for depression was emphasized by these researchers. Safone made the assumption that actively talking about suicide and mental illness as a whole will help peers to see suicidal behaviors in others and encourage those with suicidal tendencies to seek help. The program he evaluated was a suicide prevention program that focused on suicide and how to recognize signs of those at risk for suicide and what to do in those cases. Common ground can be found through extension. Another theory used in education is cognitive dissonance theory, which is applied when there is an inconsistency between attitudes and behaviors. Something must change to eliminate the dissonance. With this theory in mind, it can be seen that both curriculums are working towards educating students that mental illness and suicide are not normal behaviors and encouraging attitude changes to seek help and end the stigma attached to the issue. By using the theory of cognitive dissonance, school-based suicidal education programs can be aimed at changing students' attitudes and behaviors. However, for these programs to be successful, the same theory should be applied to the human resource aspect of the issues and the faculty and staff training efforts. For successful implementation of a prevention program and to be fully capable of helping at-risk students, school faculty and staff should be trained to change their attitudes and behavior towards mental illness and suicide and destigmatize the issue rather than being trained solely to go through the motions of prevention and intervention. Through the disciplines of health education and human resources, school can work towards creating prevention education strategies to become an integral part of decreasing adolescent suicide. Health education programs in the schools for the students to teach them of warning signs and how to seek treatment and help will not be enough on its own to decrease suicide rates. School faculty and staff need to be fully prepared to understand how to find at-risk students and refer them to help. By training staff and educating students, attitudes about mental illness and suicide can be changed, and those in need of help can feel more comfortable to seek out help as the stigma surrounding the issue dissipates. If this type of community is built in schools, a decrease in adolescent suicide may be seen. And here are my references used throughout the presentation, and I hope y'all enjoyed it.